Hello everyone. Today I thought it would be useful to talk to you about the common and not so common COVID-19 symptoms that you can suffer with if you become infected with this virus. Many of the common symptoms are recorded on a daily basis on news reports. However, just as a reminder, if you had this virus, you could present with a temperature or fever, you could lose your appetite, you could feel very fatigued, you could also develop a dry cough or a runny nose. You could also have a loss of taste or smell, which is highly irregular. And in the worst cases, you could obviously develop shortness of breath, especially if your lungs have been impacted by this condition. But most recently, we've discovered that some patients are also presenting with skin rashes. And this is after a group of French dermatologists went to Italy to assess a number of the patients who were hospitalized there with this condition. And what they were able to find was that 20% of these patients either presented at the beginning with a skin rash or while they were hospitalized. And the skin rashes at this point that they noted presented with generalized redness in some cases. That redness could be blotchy or spotty and seemed to linger mainly on the patient's trunk, as in their chest, back, and on their arms and legs. Some patients also developed an urticarial rash, and by that we mean they developed a number of red wheals on the skin. These wheals are just very well-defined red, slightly swollen areas on the skin, which can be a bit itchy or a bit burning. And some patients also developed a rash which they said looked a bit like chickenpox, so a chickenpox-like rash. And as you know, chickenpox also presents with red spots on the skin. Some of those spots look a bit as though there's fluid in them, so we call them blisters. And that's very distinctive to patients who have chickenpox. In addition to that, there's one American dermatologist who has described in his patients small bruises, particularly on the patient's legs. This suggests that the virus is in some way impacting on the small blood vessels in the patient's skin. So this is all very useful and interesting because it may be that some patients, the only symptom they will ever have and notice would be a skin rash. And in this time where there is not widespread testing as yet, it would be useful to know if this was your presentation for COVID so that you could seek help from your GP should this happen to you. But I don't want to alarm you, so please don't get panicked every time you develop a new spot on your face or whatever. It's unlikely to be very common that this is going to occur. In the meanwhile, stay safe.